Good morning, good afternoon, and good evening, everyone. Today, I'm very honored to interview two special person, two excellent professionals with a great experience in the methodology. But I can also say two friends, Pierre Côté and Thorsten Meyer. Just a very short introduction to Pierre and Thorsten. Thorsten is a psychologist, professor for rehabilitation science at the School of Public Health in Bielefeld University in Germany. And he is one of the Cochrane Rehabilitation promoters and an active member of the methodological working area of our group of Cochrane Rehabilitation. He is also president of the German Society of Rehabilitation Science and editor-in-chief of Thai Rehabilitation Journal. Sorry for my German pronunciation. Pierre is an epidemiologist. He is a professor in the Faculty of the Health Science at the University of Ontario Institute. And he also professor of epidemiology at the Dalla Lana School of Public Health at the University of Toronto. And he is the chair of our methodological working area, and he is actively involved in various projects with the WHO. Continuing the discussion of the session before, the key element of evidence is its methodological quality and the need to develop new methodologies. And I think it's particularly true for the rehabilitation field. So I will ask to Pierre to explain the mission of our methodological working area in Cochrane Rehabilitation and why it is important to have a specific area on this specific topic. Thank you, Pierre.
Thank you very much, Chiara, and happy 5th anniversary to Cochrane Rehabilitation. It's a great pleasure to be here. And as Stefano mentioned in his introduction, over the years, there has been perception that the research that was produced in rehabilitation may not be as solid as in other fields of medicine and healthcare. And there is also significant challenges, methodological challenges that are unique to conducting clinical research in the field of rehabilitation. So the purpose of the methodological working area and methodological committee is really to improve how research is actually conducted in the field of rehabilitation, which is extremely broad, as we know, but also to improve how we report our research so that when systematic reviews are done based on our evidence or the evidence that is produced in the rehabilitation field, that it is properly assessed, reported, and synthesized so that it can lead to meaningful recommendations for clinicians and their patients. So in a nutshell, Chiara, this is how I would summarize our task at the methodological working area.
Thank you, Pierre. And in this perspective, I would ask to Thorsten if he can summarize the activities of our area during these 5 years, and if we were able to respond to this this question, to this task, very important task for us and for our field. Thank you, Thorsten.
Well, thanks a lot, and greetings to all worldwide. It's quite a fascinating thing again and again to collaborate on the whole earth, and people who've just got up in the morning and sit in front of the screen. Others are sitting now in the evening dark, and so it's quite interesting and fascinating. While at the same time, actually, when I go back to the Cochrane methodology, the great impact was meeting, actually, coming together in a room and discussing things. And I remember our first methodology meeting in Paris, where we had 2 days of discussing very different methodological issues. And the first meeting, when I recall that, dealt with very different methodological issues. So we try to find out what are the main issues we want to deal with within the next years. And as you can already see, one thing that came up was to deal with the intervention studies, with the role of RCTs in intervention studies and possible alternatives here. And as Pierre just said, the quality, that is how things are conducted, how research is conducted, and then how research is reported are the main, have become the main focuses here. When it comes to, then we focused our activities a bit more into projects, and two of the main projects of Cochrane Rehabilitation are actually methodological projects, and I think we will talk about them a bit later. The one is the RCT REC, where it's about the reporting of RCTs in rehabilitation research, and the other big project is about definition of rehabilitation. You might ask, what has that to do with methodology? Well, it has a lot to do with methodology, because we need a definition in order to search for rehabilitation evidence. If we don't have a common understanding of what we're dealing with, we can't really search and produce respective evidence. When you come to the objectives, I think, well, we are far away. We've started our mission, but we are far away from reaching our objectives, and I don't think we will be managing that in a short time. But I think what really has started, and which is quite fascinating, is that collaboration around the earth. In these meetings that Stefano mentioned already in Paris, then we met 1 year later in Kobe in Japan at the ISBM meeting. Then the next year in Milan, actually in the beginning, in the wake of the COVID-19 pandemic. And then 1 month later in Orlando, where actually we from Germany were even not more allowed to travel at that point of time. So we were rushing into this pandemic, but this exchange from very different disciplines, and as Tracy said, collaboration is one of the key principles of Cochrane. This is really fantastic, and we reached that goal because we have clinical epidemiologists, we have clinicians, we have psychologists, we have philosophers, and we have the different therapeutic groups that work together on methodological issues. And if you say, if we have reached that, yes, we've reached that objective to come together and work on common issues and methodological issues, and yeah, we reached that objective. Thank you.
Thank you, Thorsten. In this situation, in fact, we work a lot. We started with the main important project. So considering this, our experience of this, our first 5 years, I would ask to Pierre probably a very difficult question. That is, what do you expect from the next 5 years, and which could be the future challenges of Cochrane Rehabilitation and for all rehabilitation community, I think we can say.
Thank you, Chiara. So I guess I could look in a crystal ball and try to predict what's going to happen, but I will not do that. In fact, what we did at the methodological working area is embark into a prioritization exercise of what should we prioritize as a working group in terms of improving the methodology. And there's a couple of areas that I think will be very impactful over the next 5 years, I hope. One is the work that we are engaging in terms of understanding the impact of methodological bias on the internal validity of randomized controlled trials and observational designs. I'll take a very clear example for all of us. It's virtually impossible to blind participants, patients, clinicians, and other individuals when we do randomized controlled trials. But how does that actually impact the results and the validity of the trials that are done in our field? And if it doesn't, well, why should our randomized controlled trial be penalized when they are critically appraised using the Cochrane tools or other tools? So these are the types of issues that we are embarking in to try to inform, one, the impact of traditionally viewed bias on our work, but also to try to propose solutions for clinicians and researchers who actually are doing this work. So this methodological work that we are starting now, hopefully will lead toward the later part of the next 5-year cycles into guidance and recommendations, both on how we can adapt our methodologies to prevent or minimize the impact of these biases, but also how we can actually report in our papers and our trials issues related to these biases. So there'll be a body of work, methodological work, meta-regression analysis, other techniques that will be used. Then we will embark into translating this evidence into guidance for researchers and clinicians. And finally, one area that I think we'll all have to work on is, once we've developed this work, how do we put together implementation tools so that it can be easily used by researchers, individuals who do critical appraisals, and journal editors. So I think we're building up from the ground based on the unbelievable work that has been done by you, Chiara, by Thorsten, by the methodological committee, and hopefully the next 5 years will lead to significant improvement in the conduct and reporting of trials and other studies in our field. Thank you.
Yes, thank you, Pierre. You highlighted I think 3 very important points. The importance of to conduct in a good way the evidence, to report in the good way the evidence, but also I think we faced with another important issues, that is the rehabilitation definition for scientific purposes, because what we are highlighting during our 5 years that sometimes the definition of rehabilitation is very broad, and is quite difficult to use this definition in evidence, to summarize evidence and so on. So Thorsten, please, can you explain what is this very important but also ambitious project to the new definition of rehabilitation for scientific purposes?
Yes, thank you. And I think it adds a bit to what Pierre just said, because it's also about external validity of our results, which is the key actually of what we do in Cochrane, is to change practice. And this is about external validity. So we have to keep that in mind. And the definition project relates to this external validity. It's quite fascinating to see when you talk with colleagues from different countries. We talk about rehabilitation, and you realize you have different understandings of things, and you have to really, identify those differences and to understand that we are talking about really different things here. So we realize that it's quite important to have a common understanding of what we mean when we talk about rehabilitation, and every country has its own traditions, but we need a common language on an international level. Well, ISBRM has been quite far in that regard to develop a common understanding, and it became quite apparent in Cochrane Rehabilitation that we need such a definition too, because when the group started to look at relevant reviews relevant for rehabilitation within the Cochrane library, they had to build on an understanding of rehabilitation in order to identify relevant systematic reviews. And a lot of problems that arose at the time were, is that rehabilitation? Is that not rehabilitation? Sometimes we came across reviews where we'd say, well, this is rehabilitation, but the authors don't call it that way. Other times we've seen things that people our authors called rehabilitation, where we said, well, this is not really rehabilitation, is it? So to deal with this, it has to do something, well, I'm a psychologist, I would call it sort of identity work. You need a common identity, a common core, and we need something that we could communicate to others within Cochrane to say, this is what makes up rehabilitation. This is the core of rehabilitation. This is our field. So it has two sides, this kind of work of rehabilitation definition, and we've gone a long way. Now we have looked at different rehabilitation definitions in the field. We have consulted a lot of experts. We have done different studies. We've made a Delphi round. We've made a lot of discussions, and I think remember the discussions in Milano with very excellent experts there. And now we've come up with a definition we will present soon that is sort of a proposal for the community, for the Cochrane community, to say this is what we understand as rehabilitation, and this is what we don't see as rehabilitation. For example, we will come up with a definition that describes rehabilitation as a process and not as a single intervention. So it's not the single intervention that makes rehabilitation, it's more about it, and the more is within this definition. And it will be quite fascinating then to see how it's working, how this new definition, which is not new, but it's bringing together different aspects from different definitions, how this definition is really working then in practice and application of identifying evidence.
Thank you, Thorsten. Yes, you explained very well, but you also highlighted very important point. I don't know if Pierre wants to add something in particular about the difference between a rehabilitation as a process and not as a single intervention, and how we can apply this process in our evidence when we perform a randomized control trials or systematic reviews. If you want to add some comments, Pierre.
Yeah, very briefly, I think one of the key issues in rehabilitation is that, as we all know, the interventions that we provide need to be tailored to the needs of an individuals and their families and their environment. And therefore, it's not like you have one single pill that you can give to everybody and hope that it will have the same effect. So that's a very important reality of the work we do. The other aspect of this equation is what kind of control group do we actually select when evaluating the impact of our interventions. Placebo treatments are extremely challenging in rehabilitation because, as we said, we cannot blind them. So how do you actually go about selecting the right control group? Is it usual care? Is it a sham intervention? So these are some of the very important issues that we're facing right now, in that are informed by the definition of rehabilitation, to bring it back to the excellent points that were made by Thorsten.
Thank you, Pierre. We will have at least other 5 years to try to respond to this problem. So, Pierre, I think the last question, because we just have 5 minutes to finish our session. If you want to explain the other important project that we started, our RC-Track project, about the reporting of randomized control trials in rehabilitation field, and why is it important to start with this specific project, and will be the future development of this project. Thank you.
Sure. First, for the participants in the audience, I would refer you to the excellent paper that Stefano and colleagues published in the American Journal of Physical Medicine and Rehabilitation last year, that describes the entire project and the background and the thinking beyond it. So just in a couple of minutes, RC-Track is really a project that aims to develop a reporting guideline for randomized controlled trials in the field of rehabilitation, as we discussed, to try to improve how our guidelines are reported and then evaluated. So the project started in 2018. I wasn't there yet. I came in 2020. Thank you for getting me involved, where a group of experts, the executive committee and the advisory committee, got together to identify key methodological issues that needed improvement in terms of reporting. These topics, there were 8 of them, were then investigated in terms of understanding what is known in the literature. So there were literature syntheses and searches that were conducted, and most of these papers have now been published. I'm sure that you can find the references on Cochrane Rehabilitation website. And the topics that we dealt with range from how do we select patients, is what about blinding, and how do we select treatment and control groups? How do we actually report in a consistent and well-informed manner the outcomes that we select and use in our trials? So these 8 areas or topics that were investigated, and a report has been published now in the rehabilitation literature, inform the development of a Delphi process of member of Cochrane Rehabilitation. And the purpose of this Delphi process is to identify key reporting items. If you think of a corn sort or an equator type of guideline that would be implemented in our field. So we're now at the phase where we're developing the guidelines, the reporting guidelines, and that will lead to a final consensus meeting and the publication of the reporting guidelines in the literature. We think that this is greatly going to improve how our research is appraised and understood, and in the impact that it can have for patients. So that's how I would summarize it. Thorsten, you were part of it from the beginning, so I'd ask you to add anything.
Yeah, I think it can draw a good bridge to what you said in the beginning. The work we do is about the improvement of reporting and conducting. So we are dealing with reporting at this point in the RCT project, but we realize that it's not just about reporting, it's actually about conducting and about good quality in doing an RCT. And I've learned a lot during this process with regard to conducting, and we hope that we can translate that results also to the level of conducting good studies there.